Hi, all of you knew that smoking is injurious to health. But how many of you knew that smoking has great impact in your oral cavity? Here's Dr. Happy sharing you some details about the effects of smoking in the oral cavity. The people who smoke usually develop lot of stains in the tooth. They also develop pigmentations in the oral cavity, mainly in the cheeks and the lips. The people who smoke, they are more prone to dental caries. They have altered taste as well as the smell sensations. They have bad breath. We used to call it as halitosis. Actually, the people who smoke, the harmful effect of the cigarette that will directly attack the gums and the gums will become weak. There will be pus discharge from the gums. The gums will look like a pale, puffy and fibrous because there is more deposition of the plaque on the tooth surface as well as decrease the oxygen into the gums. And because of the harmful effects of the cigarette, the gums will get receded away from the tooth. That is, the gums will come down below the tooth structure, and we used to call it as gingival recession. And because of that, the roots get exposed and they are more prone to the root caries. And they will be more sensitivity to cold waters, and as there is gingival recession, there will be lot of gap developed between the tooth surfaces, and more food accumulation will be there, and the tooth will become loose because the tooth get weakened because of the losing they lose the support from the gums and the periodontium. So the tooth become mobile and they will lose the tooth at the earlier stage. The recent studies have shown that the people who smoke will lose their teeth at the earliest stage when compared to the people who don't smoke. So actually, the people who smoke also have developed a weakened immune system. So if they are doing some surgery, they will prone to the post-extraction as well as post-surgical complications like infection, and we used to call it as post-extraction complication dry socket. They will more prone to get the dry socket, and dentists usually don't recommend implants for the people who smoke because of these complications, because of the weakened immune system. And because of this bad smell and bad taste, they cannot enjoy eating the good foods because they will feel like bad taste in their mouth. And we used to call smoker's palate. That most of you know that this is the area we used to call it as palate. Usually the people who smoke, they will develop this part, they will develop whitish patches as well as the red papules. We used to call it a smoker's palate. Usually it is painless lesion, and they will also develop lot of ulcers in the oral cavity. And because of the weakened immune system, they will more prone to more dental diseases too. And the people who smoke are high risk of getting the mouth cancers. You can see some reddish or whitish patches. If you notice something in your oral cavity, you have to visit the dentist to rule out to see for any precancerous lesion or cancerous lesion, because they are more prone to get the mouth cancers. If there is any lesion like growth or any lesion which is not painful, you have to rule out for the cancerous lesion. And you know that smoking has lot of impacts on the oral cavity, this much of injure to your oral health. But so you have to visit your dentist and check for any precancerous lesion, and you have to do a scaling to keep your mouth clean, your mouth as well as your gums clean. And if you are smoking, you have to immediately wash your your mouth with water, as well as you have to wash with mouthwash, and avoid the acidic drinks, because this acidic drinks that will again it will cause erosion on your tooth surface, because already your gums is receded and your root gets exposed to the oral cavity. So when these acidic foods again it get attacked onto the root surfaces, you will get more sensitivity, as well as you will be prone to more root caries. And it's never late to quit the cigarette. So as soon as possible you can quit the cigarette. If you feel difficulty in stopping the cigarette, please reduce the number of cigarette you are using per day. And as there is lot of gaps in between the tooth because of the gums recession and bone loss, you can use the interdental brush as well as the interdental floss to clean the food accumulations and deposits in between the tooth, so that you can maintain a good oral health. And you have to visit the dentist on a regular basis to do a scaling, as well as to check for any precancerous or cancerous lesion, and get it treated at the earlier stage. So I hope this video is useful for you. Please do like, share and subscribe, and stop your cigarette habit, smoking habit, and live a healthy and a happy smile. Thank you.